When our members are needing resources, we know you want to do more cash. We get it. But you're still doing insurance, many of you are, and you want to make it as easy as possible. So we wanted to find out who's the best out there. That's why we reached out to Brandy.
Hello, everybody. Thank you so much for joining us today. We are very excited to be bringing you a very special presentation. My name is Holly Jensen. I'm Chief Operations Officer here at Cash Practice Systems. And today we are going to be going over understanding healthcare credentialing and enrollment. And we're so pleased to bring a certified credentialing special with us, Brandy Brimhall. And you guys have probably heard of Brandy because she's been serving in the chiropractic profession for 25 years. She's got a few years more than me. I just celebrated 22 years. She's going on 25 years. And she's been serving chiropractic and multidisciplinary practices since 99. She's received professional certification from the AAPC as a certified professional coder, a certified professional compliance officer, a certified professional medical auditor, and a certified credentialing specialist from the Practice Management Institute as a certified medical compliance officer, and from the Chiro Code Institute as a certified chiropractic professional coder. And she's routinely featured in a number of publications, as well as, you guys know, she speaks all over at seminars and webinars across the country, and we're really honored to have her with us today, sharing with our Cash Practice audience. She provides training and education, as well as assists practice with coding, collections, compliance, credentialing, revenue cycle streams management, and as the founder and director of business development of Rapid Credentialing. Like, what an honor. Brandy, thank you so much for joining us today.
Thank you for having me.
You're welcome.
And I'm here.
You're welcome. And I know we have people, some people getting on. So as we're waiting for people to get on, just a couple of housekeeping rules. This webinar is being recorded, so I will be happy to send out a copy of it. So don't worry about that. And if you're not able to attend for the whole thing, we will also email that out to you. Furthermore, I have a couple of questions that I wanted to just ask to get you guys in the participation mood. So our first question that we have here, and Brandy, you should be seeing this as well. Do you want to just ask the question and explain what we're...
Yeah, the first question is, do you have claims and billing challenges? And, sometimes you get claims rejections or denials that don't make sense. And is it possible that these could be related to credentialing or enrollment, or perhaps both of those things? And certainly there's, we could have coding errors and billing errors, but that's downstream in the revenue cycle system. But do you have challenges with your billing that might be related to credentialing or enrollment?
Great. And we see, it looks like, everybody's here because they're like, yes, credentialing, or like both credentialing and enrollment. And I know you're going to hit on those topics today. So I'll share the results here. You can see a majority of everybody here is specifically in regards to both. They're having challenges in both of those. The next question that I want to go ahead and launch here. Whoops. Polls and quizzes. I promise I've done this before. Okay, so our second question here. Take it away, Brandy.
Sure. It says, are you confident that your business or your providers are properly enrolled with the payers and networks that you submit claims for? Just yes, no, or an unsure on this one, but anytime something takes place with our clinics, we're not always sure how our credentialing and enrollment, what it really looks like. And because we have to submit our claims according to that, do you have confidence that that's being done correctly?
Yeah. And the reason why unsure is on there is because some of you joining us today, you're like, Look, this is all new to me. I'm here on this webinar for you guys to help me figure it out. So, pretty interesting results here. We'll share the results here. You can see almost half of you are kind of unsure. So you're here hoping to learn something today. And then thank you guys so much for your participation. We have one last question here. Let me go ahead and launch that. I'll let you go ahead review that, Brandy.
Perfect. This one is, have there been changes to your business where existing enrollments may need to be updated? So for example, have you added a new location? Have you moved and changed locations? Have you added new providers? Maybe there's been something changed within the business, like you're transitioning over to an integrated facility or back from integrated to chiropractic. So have there been any changes that might prompt some updates in your existing enrollments?
Wow, look at this. Like half of the audience is a big yes. And some of you have some future plans to change this as well, which is why we're asking this. So very excited. I'll share those results here. But so this is a good segue into, you guys are here in the right spot to learn from Brandy today. So I know we have a lot of content to get through. So Brandy, I'm going to let you go ahead and take it away.
Perfect. Thank you. I'm just going to check here to make sure I can share my screen.
Yeah, share the right screen. You want to make sure you don't pull a Holly.
Perfect. So I will just tell you that, many of you, we may have crossed paths at seminars and webinars. And, if we haven't met before, I'm glad that you're joining us here today. The revenue cycle system is my favorite thing ever. And I love everything about it end to end. And so today we're spending time really at the very beginning of the revenue cycle system as it relates to dealing with third-party payers, and that's credentialing and enrollment. Because certainly if we're not set up properly with our payers, then we are, at risk of not getting paid properly, and all of these other different types of things. As we kind of just jump into the nuts and bolts of it, I did want to share with you a couple of things that I at least find valuable. The why always matters to me, and a couple areas. Actually, I guess if you look at the clinic or your business, as there's three main bubbles that we spend our time making sure are really in a good place and that they're healthy and properly defined, properly managed, all of that in order to run the business, get paid properly serve our patients, all of those types of things. Credentialing and enrollment happens to fall really under two categories. And one of those happens to be the rules and regulations that we're required to adhere to in order to manage our business. And the other part, of course, is the revenue cycle system, particularly if you are preparing and submitting claims to any third-party payer. So we're going to actually be spending time a little bit on both of these bubbles of the business, if you will, and addressing the credentialing and enrollment aspect of it, which of course is a very narrow aspect, but certainly very important, because as it relates to insurance companies and third-party payer management, this is really that foundational piece. And it's like if you're building a structure, you have to pour a good solid foundation in order to build a structure that's free, or at least has minimal vulnerability risk and things like that. So today we're pouring that foundation with credentialing enrollment and going through that. The next thing I want to share with you before I jump into really what credentialing and enrollment is, how it works, and all of those types of things, is really to let you know that I speak with clinics every single day. And one of the most common statements I'm hearing from the docs and from billers and CAs is saying, we just want to figure out how to get paid properly. And I know Holly is in 100% agreement with that also. And I am right there along with you. The other thing that I would add to that is you also want to be in the best position to keep the money that you have been paid. Certainly by billing outside of how we're credentialing and enrolled, not being credentialed or enrolled correctly, making errors in those areas are going to put you in a position where there is vulnerability of either not getting paid correctly for what you're doing, or not being in the best position to keep the money that you have been paid. And so as we move into, again, the nuts and bolts of all of this, I'm going to share with you really what credentialing is and enrollment, why it matters, and other information that I think we run into a lot of questions and uncertainties with that, because in our clinics, our focus is really largely beyond the credentialing and enrollment, but it is a fundamental piece to our revenue cycle system. So I'm going to start first by just sharing with you what it is. And the most important thing I think that I would share with you in this regard is that credentialing and enrollment, we look at it as though it's one thing, and these are actually two completely and entirely separate processes. And that matters because there's a lot of times we feel like as we are going through this process, perhaps on our own, or maybe having someone on our team take applications and accounts through credentialing and enrollment, we don't make it from one step to the next. And so I want to share with you what these two separate pieces are. So credentialing is actually where the payers and networks screen you for your qualifications and standards. So this is where they begin to identify that you are properly licensed, you're located where you say you're being located, you have malpractice coverage that is current and up to date, that they review if there's been any previous audits or any risk to them. So we've all heard about fraud, waste, and abuse, and this is the kind of the payer side of things, if you will, where they're evaluating to make sure that the payer that has submitted for enrollment or for registration for out-of-network, if you're registering as an out-of-network provider, that this is a sound provider and sound business to allow claims submission and claims processing for consideration of coverage. So that's one big process that we go through as we're going through the credentialing and enrollment. Now, the enrollment process is what happens after credentialing, and this is where if you're enrolling as an in-network provider, here's where you're going to be establishing your contract, so a relationship with that third-party network. And this is going to allow you to access the in-network benefits from the patients, where your claims are going to be processed according to those in-network benefits and limitations that the patients have under their individual policy. This also is, that contract is what ultimately outlines your obligations as a provider in order to communicate with that third-party network as an in-network provider. And so your contract will give you all of those details that outline what you can expect from the payer, what they expect from you in order to access coverage, be considered for reimbursement, and of course, to be in the best position to keep the money that you have been paid. The other side to this is once you complete credentialing, if you are enrolling as out of network, you don't go through the same type of enrollment process. It's typically called a registration, and this is where they approve you as a submitter for that third-party payer. So if you get claims rejections and you're out of network, it could be because that payer, not all of them do, but it could be that that payer or network requires an out-of-network registration, and until they recognize you as a provider, you may not have your claims going through. So different things like that, but it's important to understand what that looks like and how it works, because this is where clinics sometimes run into funny EOBs that doesn't make sense to them, or claims rejections and other issues that you think everything should be in order, but it isn't. I love to follow everything upstream and see where I can peel back the layers and identify and correct the interferences. And this is one of those areas of interferences.
Brandy, I have a quick question for you.
Yeah.
The comments that we've got from a practice on with us today says that they've been enrolled into a network against their will. What are your comments about that?
So sometimes that happens, and typically when something like that happens, it is because there was some network or change to a network they're already in, and somewhere in the fine print they have been added to it. It may say that by agreeing to this policy or agreeing to submit and accept claims from this payer, you're also agreeing to submit and accept claims from that payer as an in-network provider. And so that does happen. The very best thing that you can do to minimize that occurrence is to read those types of agreements before you sign and send them in. The other thing that you can do is, kind of back up through the system and figure out what network that's attached to, because it's possible in some cases that you can remove or undo that enrollment, but sometimes they really are attached to one another, and you get more than what you bargained for sometimes when you are moving forward with networks. So extra important to pay close attention to those fine details, but that does happen on a pretty regular basis, actually.
Wow, that's terrible. I know that's something that you'll explain more as a service as to what rapid credentialing can assist with. So we look forward to getting more information about that.
Perfect. So just really to quickly go through the process of credentialing and enrollment, and I don't want to, bore you with all the granular details, but really the sum of it, or the high level, so that you understand how it works, is we provide and prepare an application, or you would prepare an application that's completed with all of the information related to your business, your provider or providers, the location, the hours, and all sorts of other details, copies of malpractice coverage, lots of information. And this is submit either manually or online through a portal for consideration and processing through credentialing if you haven't been through credentialing yet. This goes through, and it really is a passing of baton from lots of different departments and people to approve all of this information and confirm that it's accurate, and you are determined to be a provider that's been fully screened and eligible to either be registered as out of network if it's required, or to move forward into enrollment if that's ultimately your mission. So what happens then is we go through the review process on credentialing, and once that's approved, your application, if you're enrolling in the network, will then move forward to network enrollment. Then there again, it's processed by a different team or a department of people that will go through and confirm all of the provider data, the location, all of your demographics, lots of different information to confirm if you're eligible for an in-network application. Takes quite a little bit of time to go through that process, because again, we have everything that we can do on our side to make things move smoothly. There's a lot of things that happen in the networks and their rules that they have to follow in order to move all of these things through to ultimately what would be approval. You're issued sometimes questions and requested for additional information at this time, and then your contract is issued for your review and ultimately your signature. Once you get all the way to that, you're approved and you're given an effective date for that particular network and that particular payer, or the payers that go under that network, as far as when you're going to be eligible as a network provider with that network. One of the common questions I get asked is, how long does it take? And the payers will tell you, or the networks will say, for a new enrollment, the average time is 120 to 180 days for all new enrollments. And so these are providers or businesses that are going through credentialing and then enrollment. If you are already enrolled and you're just making changes to that, adding a location, moving to a new location, that type of thing, that goes much more quickly, and that averages around 60 to 90 days for most of the networks and payers out there. And so that's the average. And again, it's a pretty good ballpark most of the time, as long as your enrollments are completed, corrected, are free of any issues or challenges that the payers or networks would run into. They really are pretty close to those timelines. The one departure is if you're enrolling for DME. Medicare DME does take a little bit longer than that at this time. A lot of times I get asked, well, what's the difference between in and out of network? We are wanting or curious about these different payers and networks, but we don't know what that really means as far as in and out of network. And so I've broken this down, what it looks like for you as the provider, and what that means to your office. And so as the provider, an in-network provider, you have a contract with that network, which like I mentioned, this identifies your obligations as the network provider. So this covers things such as your requirements for submission, your acceptance of the allowed fee schedule, different things along those lines. You are listed then on a payer network directory, which is typically pretty easily accessible online. This gets you access, like I mentioned, to the in-network benefits for your covered services that meet that payer criteria. And of course, a benefit to being in the network is you do have the expectation of increased patient volume due to network status. And the reason for that is patients are likely to go, if they're using their insurance, somewhere where there is a lesser out-of-pocket for them. Alternatively, as an out-of-network provider, you, the provider, don't have a contract with the payer network, but it's important to keep in mind that the patient does. And so you're still obligated to make sure that you're not interfering with the patient's responsibility. And what that ultimately means, you can't waive copays, you can't waive deductibles, you have to collect from the patient as you're obligated to according to how those claims are processed. But you can submit claims to access the out-of-network benefits and limitations according to the patient's policy. And in this case, if you're not in the network, you have the option, of course, to require your patients to be self-pay in cash. And for covered services, certainly they're welcome to self-submit, and they can request a super bill from you if you opt to do that. exclusions to that are Medicare and most of the state Medicaids. They won't allow patients to self-submit. So please don't do that, or you'll be getting a letter from those particular networks. For out-of-network reimbursement, with many payers, the reimbursement does tend to be slightly higher than in-network. And the reason is because as an in-network provider, the networks say, well, we're doing basically marketing for you and helping to not guarantee, but certainly give you the opportunity to increase your patient volume, which then, of course, increases your collections. And so that's the reason out-of-network benefits, or not benefits, reimbursement, I should say, tend to be just slightly higher. However, keep in mind that your patients' deductibles, their out-of-pocket, that's going to be higher as well for those patients. So just a couple of things to know. For the patient, what in and out of network means when they hear that, for the patient, they think, oh, okay, if the provider's in my network, my deductibles, my copay, my out-of-pocket is likely to be less. Coverage tends to be better in general, so lesser limitations to coverage and benefits for the in-network provider. And then they can find providers more easily on those directories like I mentioned a moment ago. For the patient, when they hear that you're out of network, isn't necessarily a deterrent for them, but it does let them know I'm going to have to pay more out of my pocket. My deductible is going to be higher, and my other patient out of pockets, my copays, co-insurances, and things like that are higher because my provider isn't in the network. Also, it tells them there are likely to be more limitations to my coverage under my out-of-network benefits plan, sometimes no coverage at all. So docs, this is sort of a side wheel to this topic, but this is the reason, one of the many reasons I should say, that it's so important if you're working with insurance companies to make sure that you verify benefits, to communicate with your patients, and you verify them correctly so the patient isn't being miscommunicated with as to what to expect for coverage and reimbursement.
And I would say, like, a lot of you probably deal with this as well, as patients, they're like, oh, I have insurance, but they have no clue if they're in network or out of network. They just know they pay a monthly premium, and they want to know, like, well, what is it covered? So yeah, like Brandy said, just make sure you are verifying benefits correctly and accurately so that you can be sure to communicate their financial responsibilities with them.
Absolutely. One of the common things that comes up in my office is, well, I'm looking into some of these networks, but I'm not really sure the best ones for me or for my office. So how do I go about deciding where I might be interested in being enrolled? And so I do have a little bit of a decision tree for you here. And this is what we help clinics with all the time. But the first one really is just get to know your region. And to do that, you really get to know your patients, because you ask them, for copies of their insurance cards, or they're asking you, do you take Humana, do you take Aetna, do you take whatever the payer is? And that is really good information to indicate to you what may be common payers or networks in your region. The other thing is consider major employers in your area. So schools, large office complexes, different things like that tend to have those larger businesses will have the same insurance for all of their employees. And certainly if you want to treat some of those employees and have access to, being able to treat others and build by referral in that way, make sure you know those major employers and find out what their insurance is. Next, I kind of touched on this already, patient requests. That's probably one of the best ways to find out where networks or which networks would be good for you is by what your patients are mentioning to you. And then certainly if you have any target markets, so sometimes, it's athletes, sometimes it's students, sometimes it's, police and fire departments, those types of things, find out what insurance they are so you can target those markets with the information that you're able to obtain on their networks. Common one, or actually a common couple, of course, is Medicare. If you're treating Medicare patients, you have to be enrolled. Another common one that I really love to work with is the Department of VA. And so we have our veterans that have coverage through the VA oftentimes, and that's a great target market that a lot of providers like to be enrolled with. The next thing you want to do before just making the final decision is make sure you familiarize yourself with the payers and their requirements, because if there's anything additional needed on the clinic side of things, as you start to prepare and submit claims to that payer, you certainly want to know that in advance versus finding out the hard way after your claims are denying. So to find that out, ask peers or other professionals in credentialing and enrollment or billing that would be able to give you a little bit deeper insight on some of those payers and networks. And what you're going to really ask is, does this payer or network have any additional requirements that I need to know about? A really common one is, are we required to obtain prior authorization before treating the patient or before coverage will be considered? That's a big one, and it's a common one. Definitely not one that I would say don't get in that network because of prior authorization, but most definitely one I would say this is information you need to have in advance so you can proactively prepare on the clinic side to obtain those prior authorizations. Keep in mind, when something like this is overlooked, you get a copy of the EOB showing you that you're not going to be paid, and that's upsetting and frustrating, obviously, for the clinic, but the other person that gets a copy of that EOB is the patients, and they see on the remittance that that prior authorization was required but not obtained by the clinic, and it says you may be billed zero. And so it's requiring you to adjust that off because the clinic had an oversight in communicating with that payer according to the payer responsibilities or the payer obligations. And so definitely things to know about in advance, but it's all part of, working with the insurance and networks. And something we just need to again, just be aware of ahead of time to make those good decisions and be prepared in our clinics. The next thing I want to go in with you is actually just some common questions and answers. And so I would imagine as you're here with us today, there may be several questions you have for me. And interesting enough, I get a lot of the same questions all the time. And so I have tried to proactively prepare some of those questions for you to hopefully answer what you may already be wondering. Now, the first one that I get asked on a regular basis is, can I get out of a network once I'm in the network? And the answer to that is yes, absolutely. You can get out of really any network once you're in. You have to go through the process to be removed from the network. It does take a little bit of time to do that. Certainly not the 120 to 180 days, but it's usually, I would say, 30 to 60 days or so before you can be removed from the network. There is one departure from that, and this is going to be Medicare. You can transition from participating to non-participating with Medicare or vice versa. However, Medicare only allows this one time per year, and that begins roughly mid-November all the way through the end of December. So if you are enrolled with Medicare and you're wanting to switch from network status or for participating to non-participating, or the other way around, you're coming up on the time where you need to get moving with that, or you will need to wait for a full year. So Medicare has a time slot that they allow every year. The rest of your payers, you can initiate that process by taking the proper steps with the network at any time through the year. The next common question I have on a regular basis is, once I'm enrolled with the network, am I enrolled forever? And so the easy answer is definitely. Network enrollment is not one and done. You're not just enrolled and you're good to go for all of time. There are requirements that we have in order to maintain our enrollment for the business and for the providers. And so this is done through your Medicare and PICOs. For example, revalidation requirements for chiropractic is every 5 years. I did learn, actually, I was meeting with an attorney yesterday, and because of the COVID thing, it threw the revalidations off, which we all knew that anyway. But if you haven't revalidated over the past few years, best thing that you can do is check your emails for sure to make sure you're not getting reminders. But you can also find that out on the PICOS Medicare website. There's a little button that says revalidations. You can type your NPI in there and it will tell you when you're due for revalidation. Definitely don't want to miss that, because you'll stop getting paid and then be removed from Medicare and have to go through reactivation, which takes some time. If you need help, let me know, but just a quick helpful item there for you.
Okay, that was good that you addressed that, because that was one of the questions coming in is like, if they got out of Medicare, how do you get back in? So it's just a whole re-enrollment process.
Yeah, so if you're just essentially kicked out recently, you have so many days that they call it reactivation, which it's almost like an expedited process. They pushed your application through in around 90 days to reactivate you. And in some cases, they'll continue to allow reimbursement during that time, so you don't totally get cut off from payment. But not all cases, it depends upon their rules and the situation. But otherwise, you have to go through total re-enrollment, which does take, a little bit of time to go through that. But you can get there, just making sure you're proactive in getting those applications moved along.
So even if it had been a period of years that you were out of Medicare, you could just basically
You-
enroll, right?
You'd have to, yep, you'd have to completely re-enroll, but you would be able to do that, yes. And you'd go through credentialing and enrollment again. They do the screening if it had been a period of years. If it had been a period of a few weeks, then you'd go through reactivation.
Got it. Okay, thank you.
Yeah, and so the other payers, Aetna, Blue Cross, Cigna, Medicaids, all of those other payers do require monitoring your maintenance, and what they call it attestation. And so you are either having to complete documents, which is the case with a lot of state Medicaids right now. Some of them use portals, but otherwise the rest of our payers tend to use portals, and that's your CAQH, your Availity, your United Healthcare portal, that you would be required to make sure that all of the content is up to date, your office hours, copies of malpractice, all of the information that they would require to house your data, and you go through attestation. And that's typically required, depending upon the network and the payer, either every 90 days or in some cases every 120 days. What happens if you miss those periods is the first step is you're removed from the directories. The next step, you stop getting paid in network, and your claims start to process out of network, which, as you might imagine, I'm sure some of you have experienced it before. Suddenly that throws everything out of whack as far as what you're expecting to be paid, what you've collected from the patients is now incorrect. And then, the other challenges that we get downstream. So extra important to make sure that you're monitoring and maintaining those, or, there is a downstream impact. The next common question I have.
I'm so sorry.
No.
Just back on that last topic. Is
Yeah.
UHC an attestation portal?
Yeah, so every clinic that is submitting claims, United Healthcare, Blue Cross, Aetna, Humana, we're required to establish portals in order to be able to complete the credentialing and enrollment process. So once those portals are established, that's part of what the networks and payers use to confirm credentialing and confirm enrollment. And they won't allow it all the way through for approval without those portals being established and set up correctly. Moving forward, the providers have to maintain those credentials or maintain those portals in order to maintain their enrollment status.
Got it. Thank you so much our audience is asking some really great questions.
Yeah.
So keep those questions coming through, you guys. We'll make sure
Perfect.
to get them addressed.
Good. Well, I hope it's helpful so far. So the next common question is, hey, we're going to be making some changes to our office, maybe, or I'm moving, or I'm adding a new provider. How soon should I start credentialing and enrollment? And I would really just go back and touch just a little bit on the time frame I mentioned to you that is required to get the applications all the way across the finish line. So if it's an update or change, like I mentioned, allow 60 to 90 days. If it's a brand new enrollment, up to 120 to 180 days. And so the short answer is, the more proactive you can be in this regard, the better it's going to be for you in general, because it helps to get those applications through to approval and get your effective date established as early as possible. The other side that I would tell you is, some payers, in fact, the primary one is Medicare, does allow us to establish, or to request rather, a retroactive effective date. So if you're starting a payer, here at the beginning of the next month, or not a payer, starting a new provider the beginning of the next month, we could request that effective date. Or if you started at the beginning of this last month, we could request that effective date. Once that application goes through to approval, your claims can then be released and submit to Medicare, and they'll be processed and you'll be reimbursed. So you'll have a delay in getting paid, but you won't be prevented from getting paid once that application comes through to approval. The vast majority of our other payers, all of the commercial payers, with a few exceptions, don't allow us to request an effective date. You get what they allow for you based upon their own enrollment guidelines. And so in that case, you're going to be ultimately given the date that they grant to you once they approve your application. So again, just being proactive, always extra helpful, so that you don't find yourself with too lengthy of a gap in getting your approvals through and getting your claims processed in network. Next, can I start seeing patients if my enrollment isn't approved? And so you're waiting for enrollment, or maybe you have a new provider that you've added. And I mentioned the Medicare rules just a moment ago. They do allow us to request a retroactive effective date, which means if the provider is seeing patients in that time, which the provider shouldn't be seeing Medicare patients if they're not enrolled with Medicare, but so long as the retroactive effective date is requested, again, once those applications or that application is processed through to approval, you'll be able to submit those claims. As far as all of the other payers, our standard commercial payers, this actually varies by state and by payer. So this is something, if you've already started a provider in your office and they're not through enrollment all the way, then check with those networks and those payers to see what their rules are in regards to that. Most of the time, you're going to find that they will either allow the provider's claims to go through out of network, and in some cases, they say the provider has to complete, to at least be registered for out of network to have the claims go through and process out of network while the network application is being processed. So there are some, granular details that unfortunately I can't answer in total black and white, but the good news is that there are answers to this. It's just, again, be proactive, because that's always going to be your best advantage in working with your third-party payers. Next common question is, I'm enrolled, but I've changed employers, I've changed business locations, or I've moved to a new state. Now what? If you've had an employer change and it's in the same state, your existing enrollments can be transferred over to the new business group so that you are eligible to be treating and billing patients with those networks under that new business tax ID, their group NPI, that location. And so that would be an enrollment update. And like I mentioned earlier, those go through fairly quickly. If you have a location change or you're adding another location, once again, if it's in the same state, you can go through that enrollment process to update the current enrollments to show the location change or the second or third location, and those go through fairly quickly as well. If you have had a state change, this becomes different based upon payers. And so Medicare typically, especially because Medicare is different contractors in certain regions of the country, you're often going to end up finding that you've changed Medicare contractors, which means because you're enrolled with Noridian Medicare, and now you are under some other, national government services or something like that, you're going to have to do a new Medicare enrollment because it's a different contractor. At the same time, Blue Cross of Colorado isn't the same as Blue Cross of Florida, so those are new enrollments as well. So you'll have to just get to know your payers and then, be able to make the decision or work with a team like mine to help you know which ones are being updated, that it's going to go through more quickly, and which are new enrollments. But again, that's typically, as a general summary, how that works. Another common question is, for credentialing enrollment, can I do it myself? And yes, absolutely, you certainly could. A few things that you definitely need to know is make sure that you know the requirements in the process. Credentialing and enrollment is not for the faint of heart. Neither is anything to do with insurance claims, billing, and follow-up and appeals and all the things that come downstream from that. It's incredibly detail-oriented and time-consuming. Takes a tremendous amount of follow-up in most cases. And of course, then you have to maintain your enrollments too. And so you definitely want to make sure that you have confidence in what you're doing. I would tell you with rapid credentialing, more than half of the clinics that we work with have come to us because they've either tried to do their own credentialing and enrollment and something went sideways somewhere, or they had outsourced to wherever and couldn't ever get the enrollments correct or across the finish line. And so you definitely want to have confidence in who you're working with. And if you're doing it in-house, just make sure you persevere really hard and have some confidence in your action steps. And, I kind of just almost leave you with this, is time is money too. Most of the time when you're enrolling with networks and third-party payers, there is some urgency to get those approvals across the finish line, because that makes a difference to your billing, to your biller, to what you're collecting over the counter, to your verification of benefits, to what you're communicating with your patients, all of those different types of things. And so you don't want to have to continue to report to your patients, oh, this happened, or I'm not sure what's going on, those types of things, because everything impacts our patient relationship. And, time is money, like I mentioned. And so always the proactive approach with credentialing enrollment, definitely my preference for sure. Next question is, am I guaranteed enrollment approval? And there are some network panel guidelines for our networks in every single state, and you can occasionally run into closed panels where they're not accepting providers of your specialty in your region. When that happens, depending upon the payer, there's different action steps that can be taken to to at least monitor that. So my team actually monitors the closed panels routinely to look for open panels or to wait for when the panel is open. So we're notified immediately and then can push those applications through. Sometimes our applications can be held at the networks and pushed through automatically when a panel opens and we're allowed to go through. So follow up on this. Again, this is where I kind of would reiterate, it's not for the faint of heart, but follow up is extra critical. You want to make sure that you really have proactive processes in place to take every next step so you don't find your applications essentially dumped or lost or not processed through because of one reason or another. There can be many of them. The next question here is, I've had a change to my business or employment, and what does that mean for my existing enrollments? And I touched on just this one just a moment ago, but if you're adding a location or moving, definitely want to make sure that your enrollments are proactively updated so that that shows properly in your portals, that it's on record with the networks. And I would just, again, touch on the comment I made right at the very beginning of our discussion today is you want to be in the best position to get paid properly for what you're doing. You also want to be in the best position to keep the money that you have been paid. And so it's these types of oversights that often can become costly to clinics because, we have a new provider and that new doc isn't enrolled. So we're just billing his charges or her charges under another provider in the clinic until credentialing can come through. Lots of things like that put you at incredible vulnerability, not in the best position to get paid properly or to keep the money rather for what you're doing. And, the downstream impact to that can be, quite significant as well, depending upon the situation. Other changes that we have a lot in my office is if your office is integrating or maybe you're unintegrating, all of those types of things. Really anything that's going on with your clinic that would be a change to the business, you want to make sure that your enrollments reflect that because that helps you to keep compliant with those guidelines, compliant with your networks and payers, and of course in the best position to keep the money that you have been paid. So hopefully that helps to really summarize what. Oh, go ahead.
Yeah, there's one thing that some question coming in regards to that last slide. So is when you have a change in your business or employment, is that different than having to go through new enrollment as a new business since the change in provider or location, they already have their NPIs enrolled?
Yeah, so if they're already enrolled and they've added another location under the same tax ID and group, then it would be an enrollment update. And so you'd go through and there's different documents and forms and information that you have to submit, but you're adding a location that you are requesting for that location to be covered under your existing contract. And so that's how that process works, and it goes through pretty quickly. And so it would be just an enrollment update. So all of your locations are covered under that same enrollment. Alternatively, if you're adding a location, but you decide, I'm going to have a separate business because I may want to sell this one someday. So I have a new tax ID, a new group NPI, that's a brand new enrollment because you'd need to enroll that group and then whatever providers are treating within that group.
Okay, so if the group NPI that's being billed is under that it's under is not under a contract, it requires new enrollment.
Yes, if it's not under contract, the group would require new enrollment. Another thing that happens sometimes, since you mentioned that actually, is maybe you have a provider that goes back and forth between multiple locations, and maybe it's the same business entity, so the same tax ID and group NPI, or maybe it's different, it's just the same umbrella, if you will. For those individual provider enrollments, you can also, of course, go through and add, and you should make sure that they are enrolled at the location or locations they're treating. And that can easily, if it's an already enrolled provider, another location or another business can be added to that enrollment so they're eligible there. And so definitely you want to make sure your groups are properly enrolled if that's something that's necessary for you. If you're a single provider and it's just you by yourself, you may not have a group enrollment, but you'd be enrolled individually, and you'd want to make sure that that's taken care of as well. And of course, it doesn't just affect the compliance in the provider establishment, but also how you set up for billing, how your claims look, those types of things, which certainly impacts lots of different things all the way down the revenue cycle system as it relates to billing and collections.
Perfect. Okay, a couple more questions is leaving insurance. So there's cash, people wanting to go all cash, being cash based. And how is, I mean, is it just as easy to leave? Is it easier than enrolling or credentialing? Like, what about
Yeah,
you?
so leaving the networks is definitely faster. I would say probably a little bit easier. So for all of your payers, you'd have to go through the process to request unenrollment from the network. They process that through. Just like with going through enrollment, you want to follow through to make sure that it's processed and you receive notification that you've been removed from the network and the date when that's in effect, so that you're following protocol as it relates to your patient communications, billing, or just your private pay patients and transitioning your patient accounts over accordingly. But definitely easier. Still have to go through the process. The one departure from that one, of course, would be Medicare. If you are treating Medicare patients, you need to be enrolled as participating or non-participating. But yeah, you can definitely change your network status, and it does go through more quickly.
Okay, and then it looks like the last question, there might be more, but this is a good question in regards to Medicare is, can we end our contract with Medicare Advantage plan, but still stay enrolled with Medicare?
So the way that the Medicare Advantage plan enrollment works is with your, United Healthcare, Blue Cross, Aetna, is you're not eligible to access those products under those commercial payers without being enrolled with Medicare. And so you have to be enrolled with Medicare to even be eligible for the Medicare Advantage. Next is when you go through enrollment with a commercial payer, you aren't always with many of those payers just given enrollment or network status with every product that they have. So in our applications, we have to often go through and select which products or types of products that the provider wants to be enrolled with. If it's, if it's sometimes HMO, sometimes certain plan names, Medicare Advantage is another example. And that's how you would access those enrollments if you're eligible, even the Medicaids in many states, if Medicaid is covered in your state. To go through and unenroll from the Medicare Advantage, really the same process would apply. You would be still in the network with, if it's United Healthcare, Aetna, or whatever the commercial payer is, but you would have to go through an enrollment update process in order to make changes and remove certain products from your enrollment status under those payers. So still a process to go through, but if you wouldn't be going all the way through credentialing and enrollment, you'd be making changes to an existing enrollment. And that how that works, of course, as with anything, is going to be very based upon what the provider or the payer and networks rules are for those particular processes. So the interesting thing about credentialing is it's not cut and dry for anything. It's every payer, every state, they all have their different processes, and you would just follow those, but you could make updates to your existing enrollments if that's something you want to do for most of those payers.
Right, right. Okay. So you've brought a lot of great value in the short amount of time that we've had today. And I appreciate our audience being so inquisitive and asking questions because, and that's a specialty that you and your company bring to the table. Really, everything that we've gone over today, they can do it on their own, but your company helps with all of this. Can you speak to that?
Yeah, so rapid credentialing, again, it's been 25 years and I have had nothing but fun. And this is the foundation or the foundational piece to really anything to do with the insurance side of the revenue cycle system. So we are meticulous in making sure that all of the appropriate steps are taken, the proper communication with the networks and payers, the steps are being followed, follow-up is being conducted, all of those types of things, because we know that it makes a difference to your billing, your biller, your collections, your patient communications, your patient relationships, all of those things. And I've been on the clinic side of it for a long time as well, so I get it from that perspective too. But yes, I have a team. There's 8 of us actually now that spend all of our time in credentialing and enrollment. And we go through and handle all of this for you so that you are, can trust that it's being taken care of as far as checking network status. We have a lot of clinics that call us and say, I don't even know how I'm enrolled. Our billing is a little bit goofy. Can you help us figure that out? And we go through and do research to really put together a spreadsheet of this is how you're enrolled. And almost always we find that we're able to fix billing related issues and errors in that process. And we also find that there's enrollments that need to be updated. Providers have been, kicked out of networks and removed from directories, or enrollments that were never followed through with or had taken place because you don't know, you don't think about it. And so we do a lot of enrollment research, lots and lots of new enrollments for providers, and then changes because, you may be moving, you may be expanding, you may be adding another provider. Lots of things happen. And this is definitely, all of the revenue cycle system is moving, right? Everything with life has movement. So does credentialing and enrollment. So we take care of that on your behalf. And because it's not necessarily a quick process, like I mentioned earlier, something that I think you might appreciate is we're super proactive about communicating. And so you're not ever having to wonder what's the status of something. We send bi-monthly updates out. So every other Friday, you get an email telling you the exact current status of every application that we have in process for you. So you know how to communicate with your team, with your patients, and so on. So that's a short summary of how we do that, along with monitoring the existing enrollments too, to keep those active so you don't have to worry about missing emails and forgetting.
Oh, that's fabulous. And Dr. Miles Bodson, I'm going to ask you, here's our founder and CEO of Cash Practice. And you guys might be like, why is Cash Practice bringing us content about insurance? What is this? And so I'm going to have Dr. Bodson explain why we've brought in an expert like Brandy in rapid credentialing to bring you this information today.
Absolutely. You were reading my mind, Holly, that I wanted to address that. And Brandy, you did such a great job. Thank you so much. Here's the thing. Obviously, our company's Cash Practice, and we all talk about running cash, the cash portion of your practice. But we also know our members, a vast majority, if I would say it's probably over 90% of our members still do insurance. And I'm all about simplifying things. I'm all about taking things off your plate that, like, it's not your primary focus. So why do it? I know in my own personal practice, when I was in practice, we did not do billing in-house. We had everything off-site. We did not want to deal with that stuff in the office. And so the same thing here, when our members are needing resources, we know you want to do more cash. We get it. But you're still doing insurance, many of you are, and you want to make it as easy as possible. So we wanted to find out who's the best out there. That's why we reached out to Brandy after our due diligence and said we have to have Brandy on to share with you guys. And now Brandy being a resource for our members to be able to provide this service. So we encourage you to reach out to her. She'll be upfront with you, and they'll let you know right away whether they're of service that you need them or not. And if you don't, they'll let you know. And if they do, they'll be happy to share with you what they could do to service and help you, whether it's getting credentialed or getting out of networks or just getting messes cleaned up, whatever it may be. And that's why we had Brandy here today. So we've known Brandy for a long time, and it was we've been talking about this for quite a while to bring her as a resource to our Cash Practice clients.
Well said, Dr. Bodson.
Oh, thank you.
Yeah, so if I don't see any other questions coming in, you guys in your chat, I went ahead and put in contact information for rapid credentialing by phone or email. And Brandy, thank you so much. This has been really informative. It was a popular hot topic. I was sharing with Brandy, in preparation for our webinar. This is the first time that we've put out content like this in regards to credentialing and enrollment and all of this. And it's been hot. You guys wanted this information. I was sharing with Brandy, I'm like, wow, I can't believe how many people registered for the webinar. Like, I didn't know people needed that information, especially, with our clientele working at Cash Practice Systems. We hear a lot of like, I want to get out of insurance, or I want to make care more affordable for people who are underinsured, which is everybody, right? Their insurance doesn't cover all of the services, the treatment plan that the doctor's recommending, which is why people come to us, because that's something that we help. So we've partnered up to make this a smooth process, because like Brandy was saying, it's all about revenue streams, whether it's coming in from insurance, whether it's patient pocket. You really need to have a good systems, not just good systems, but great systems in place to maximize your revenue and your practice and to help as many people as possible. So any parting words, Brandy?
No, just thank you so much for having me. And it is, you're so right. It's the revenue streams. And then, everything that happens in our office or doesn't happen impacts the patient relationship, right? And so sometimes some of those things start here with the credentialing and enrollment. So thank you so much for having me. If anyone has any questions at all, you can see how to reach out to us, and we'd definitely be happy to help.
Wonderful. Thank you all so much for your time today, Brandy. It was an honor having you. We'll be sure
Thank
to
you.
do this again real soon. Have a great day, everybody.